So let's first talk a little bit about what we're seeing across the nation, and that is the talk about contact tracing and going back and trying to find how the spread of the virus is spreading in communities. Now, the reason why I say this is because, over the weekend we saw that recent cluster that was talked about in Pasadena, where health officials say that they were able to trace back kind of this cluster back to a birthday party. They say that one family member was coughing, wasn't wearing a face mask, and then all of a sudden a lot of people in that area who attended that birthday party were diagnosed. Is that something that you're concerned about with gatherings as we continue to open up the economy, as we continue to open up certain things? Maybe a lot of people think that this is a switch that you can simply switch on and go about your day, go to gatherings. Are you concerned that we could see something like that happened in Pasadena here?
Yeah, and that's one of our concerns, and it's always been, right? You want to make sure, as this is leveling off, we're flattening the curve, you don't want to get another resurgence of this. And so once again, we're emphatically telling people to socially distance. And it is difficult if you haven't seen a friend or family member in months. You want to go up there and give them a hug. But you got to try and refrain. It's really difficult, but we're at the end of this. We're almost at the finish line. And so we've got to refrain just a bit longer.
I want to talk a little bit about some of the symptoms, because just kind of a refresher, we talk about how this virus spreads. But if someone is not, who may be infected with the virus, if they're not coughing or if they're not sneezing, is it still possible for them to transmit the virus?
Yes. And the easiest, simplest way they can transmit it is if they were to touch their face and then they shook your hand and then you touched your face with that same hand, you would now get infected. So a lot of these people are considered colonizers, so they have the virus all over them. So coughing, it does not necessarily mean that they're passing the virus. They can do it all the ways.
Okay. There's a lot of confusion that I've seen on Facebook with people out, talking about hospitals and whether or not they're open for elective surgeries and so forth. Can you just give us a little bit of clarity here? Are hospitals open for elective surgeries, and are there still protocols that are being followed that maybe have some procedures or some form of interacting with a doctor that have kind of changed or been modified because of this virus?
Right. So all of our Dignity hospitals have opened up for elective surgeries. We are ramping it up. We started slow last week. We opened a week ago. So we're ramping this surgical surgeries up. Well, we want to make sure that the public knows that we are taking extra precautions to keep them safe. We are testing the patients before they come in for surgery, especially if they're having certain kinds of surgery. We are making sure that we're asking symptoms from not only the staff members, for all the physicians, including the patients. We're asking everyone to make sure they're not symptomatic. And then when they get into the operating room, the staff and the physicians are wearing the full PPE, max PPE that they could, to make sure that they don't spread anything to the patients. So actually, it's extremely safe currently to come to the hospital and get your surgery. We're taking those extra precautions just to make sure that we don't pass anything.
All right, Dr. Hamel Kothary, the Chief Medical Officer for Dignity Health Central California Division. Thanks so much for joining us once again. Take care of yourself, and we'll see you tomorrow morning.